Well, good morning, everybody. I am very sorry that I can't be there in person with you. In fact, in about an hour, I'm getting on a plane to go down south for the week. So I'm not saying that to rub it in, but just be thankful I'm not taping this from the beach. I am very sorry that I can't be there in person and that I have to talk to you instead of having the opportunity to talk with you. But I didn't want to miss the chance now that you're all gathered together to say a few words to you and to share a couple of my thoughts. First, I want to sincerely thank you, all of you, and each and every one of you, for the ongoing work that you're doing with your health links. You know that this is a priority for the Champlain LHIN. It continues to be our top priority in terms of ensuring that we have full deployment of health links across the region and that we reach 10,000 individuals that are connected to a health link and have a coordinated care plan. And that could absolutely not happen without your commitment. So I want to really thank you. You took a leap of faith with us a couple of years ago when we pitched this idea, when we said it would be good for our region, for our health system, and for the people that we serve. And you've been right along there the entire way. In fact, you've been incredible leaders in this area, and you can be very proud of the accomplishments that you've made to date in both of your health links. I sincerely appreciate that you're taking the time to gather today to think about where you've been and how much further you can go, and that you're sharing of your learnings and your experience, and that means a lot. Like I said, health links are such a huge priority. We are absolutely convinced that they can have a tremendous impact on our healthcare system and the sustainability of our services. In fact, we know of no other strategy that has such potential to ensure that we serve people in a more appropriate way and that we're getting better value for our healthcare dollars. And frankly, if we don't ensure the success of health links, we will continue to struggle with ever increasing demand for service and limited resources to fill that insatiable demand. So health links are not an option. They are the single most important strategy that we can put in place. So my sincere thanks for your ongoing engagement, your ongoing commitment. We are asking you to do something that's not easy. And I think back about my own days as a nurse, looking after patients in various settings, and how challenging it is to work in an interprofessional team, even within one's own organization. So whether I was a nurse on a home care team or in a hospital, trying to connect with all of the different providers that provide care to a patient isn't easy. And we're asking you to do this now across multiple different organizations with multiple different providers involved. So that is the greatest challenge, I think, of Health Links. We're not asking you to try to change the healthcare system or to try to spend too much time focused on how you do business, but we're really asking you to free up the time of your healthcare professionals and your clinicians so that they can actually come together and form a team around a patient and come up with a care plan that the patient knows about, the family knows about, and that everybody is clear on what their role and responsibility is within that team. It sounds simple, but it's not easy to do. And if you think about sports teams, now I'm not a huge sports enthusiast, but when you think of team sports, and you watch how team sports are played, they are highly organized. There's usually very clear who's calling the shots. Think of football. There is a quarterback. Every person on the team knows exactly what their role is. They know when to get on the field. They know when they're not supposed to be on the field. They take direction. They practice their plays in advance. They rehearse those. And they know what the quarterback is going to do. They're not running around making it up as they go with everybody deciding what they want to play or how they think they're going to score a goal. mind you, I'm sure you've watched football games that look like that, but they are, when they're effective and when they're played well, very organized and highly orchestrated. And that's what a HealthLink team needs to be. And we're not very good at doing that in healthcare. So we need somebody to be playing the role of the quarterback. Oftentimes we let the patients and the families do that, and for some patients that's totally appropriate and they want to play that role. But we're talking of the most complex people who are going to have to navigate our health system and who have multiple players on their team. And so the quarterback needs to be the care coordinator. And that person needs to be able to rally other members of the team to make sure they know what their role is, what they're being asked to do, how to play the play, and that there's a plan. And that's the coordinated care plan. And everybody needs to know about it and needs to know how to deliver against it. And no one's allowed to go and make changes to that plan without letting other players on their team know. Otherwise, we don't score a goal, we don't score a touchdown, and the patient is left and with their family trying to figure out what to do next. So the greatest thing that you can do is to ensure, and if you're a board member, it's ensuring that you're allowing people within your organization to be part of those individualized teams for each and every one of the HealthLinks patients. And that means that they are playing their role to the best of their ability, which may mean sometimes sacrificing a preferred way of doing things within their own organization or adopting someone else's way of doing for the betterment of the patient. And if you're an administrator there in the room who's a partner on the HealthLinks, it's the same message, is allowing your staff to be engaged with the individual patients and to not worry too much for the moment about changing processes or systems. That will come. That will come by virtue of realizing how you can do things and you can deliver care and services for the individual HealthLinks patients that we are looking after. We've come a long way in the last couple of years. We're up to just a bit over or just a little under 1,000 people who now have a coordinated care plan across the HealthLinks in our region. We're targeting just over 1,300 for this fiscal year, so I'm asking all of you to do a little push in the last few weeks that are left this fiscal to get us there. We're looking for an even bigger target next year, but I'm quite confident that that can happen if we focus on the fact that these are not new people seeking care and service. These are people that you already serve. And so we're asking you to put your existing resources in play to come up with these care plans, to identify who these individuals are, and to provide care in an organized and coordinated manner. So this is, again, an incredibly important initiative. We're banking on the success of this in order to sustain the healthcare services for our region in the face of growing demand and growing pressures. And we need you to continue to be involved. I know some of you have been concerned in the past, or maybe you still are, about issues like funding and continuation of funding. We are committed to this initiative. We will continue to work with you. We want to make sure there's no slowdowns or no delays as we cross over into next fiscal year, and that we keep the momentum that we have going now, and we will work with you to figure out resource requirements, etc. But again, I'm quite confident that we are capable of doing this. Both your HealthLinks are doing incredibly great work. You can be leaders, you are leaders, you can lead the way in this and get us to a scale of numbers of patients that are involved, that we can see the benefits not only for the individuals, but start to see the benefits at the system level. There's no question that HealthLinks are having an impact on patients and their families. I'm hearing the stories today about how this is a game changer for people and for the providers and clinicians who are looking after them. But we do need to scale up in order to be able to see it at the system level so that we can all reap those benefits. So I know you've got a great agenda planned for today, and that you're going to come up with some great ideas and have great conversations about the next steps and about the way forward. Again, I'm sorry I can't be there with you. I will look forward, though, to getting a report out of your day. Please be assured that the LHIN is right there with you, and we will continue to work with you and be a partner so that we can continue to show that this is not only the right thing to do for patients and families, but the right thing to do for our healthcare system. So thank you again. Enjoy your day.